Welcome to the Win, Make, Give podcast. Chad Himes here, and we have another amazing interview ahead. And before I bring our guest on, obviously I'm joined by Bob Stewart. He is here with me today. Bob, say hello to our audience.
Chad, how you doing?
I'm fantastic, my friend. You're wearing a hat. For those watching on YouTube, if you want to actually see the video to go along after or check out after, Bob, you're wearing a hat, and I got to say I don't recognize that one.
What? It's the Seattle Supersonics, Chad.
Is that a team that used to be here or something?
Don't do that to me, man. You're hurting my heart right now.
If you want to know more about the Seattle Supersonics, go listen to our Starbucks episode back from season 1 where Bob rants about that. Yet we are continuing through our Traits of a Winner series where we are bringing you the traits of a winner, and then we are going out there and we are finding winners to actually discuss the traits with and how it impacts their world, their industry, their job it might be. So I am proud to introduce our guest today, Dr. That's right, I get to say it, Dr. Brent Thiel. Welcome to the Win, Make, Give podcast.
Thank you. Glad to be here.
We are glad to have you. And doctor comes with so much. Dude, what kind of doctor? How'd you do it? All that. Introduce yourself to our audience for the first few moments. Let them know who they're going to get to hear from today.
Sure. Okay. Well, so basically born and raised in the Puget Sound area. Went to Bremerton High School, local kid, Seattle Pacific University for undergraduate, and then decided to go into medicine. It was between marine biology and medicine, and I picked medicine, not sure why, but and then headed back to Wisconsin and stayed there for 10 years for med school and residency. And so medical school is 4 years after college. And then you try to pick a specialty. And I had always interest in orthopedic surgery. So basically musculoskeletal system. So shoulders, knees, elbows, hips, that type of stuff. And then 5 years of training for that. And then after that, I actually had the Navy pay for med school. So we were supposed to come back to Bremerton Hospital, Naval Hospital, and work there for a couple of years. And at the last minute, the guy calls me and says the detail. He basically tells her where they have to go. And they said, "Hey, you're not going to Bremerton, which is your hometown, but you're going to Guam." So packed up me and my family, my wife, and 3 young kids, and they shipped us to Guam.
Was that like your residency was done there?
No, so I'd finished my residency. So okay. I was basically a full-fledged surgeon, and the Navy said, "Hey, we need you to go to Guam." And so, so that was in 1999. So we packed all our belongings, moved to Guam, started practice there, just helping out, taking care of the Navy folks and their families, and actually had a great time. We really enjoyed it.
Well, we thank you for your service. And how long were you there for?
So my orders originally 2 years, but then in what happens in 2001 with 9/11, things changed dramatically. So Guam was considered a forward deployed station, so they couldn't ship me from Guam to anywhere in the Middle East. But all my buddies that were leaving Guam, going back to San Diego or Bremerton, they were shipping them over, and so I kind of figured that if I stayed in Guam, I'd be protected. And sure enough, so I stayed 2 more years there. So it was for 4 years.
Awesome. Wow. Okay. So I heard so many things in that intro that you and I could be just talking about. My daughter is studying to be a marine biologist. Maybe you can get her either to stay on that path or help her become a surgeon really quickly for the opportunities ahead. And I got a pain right here in my shoulder that I figured we could talk about, but we could do that after the episode and all of that. So I got to ask, were you the kind of kid, because you sound like you had a plan there, were you the kind of kid that said, "I want to be a doctor when I grow up"? Were you the kind of kid that mom or dad said, "You will be a doctor," and had it lined up for you? Or did you just almost fall into this?
No, I pretty much kind of fell into it. So I was pretty smart. I took school fairly serious, but back then it was nothing like it is now. I mean, I remember my mom taking me to our local college to take the SAT test on a Saturday. And I'm like, what are you ruining my Saturday for? What am I doing here? This is crazy. What? No, I don't want to do this. And then even college was kind of a last minute thing. Like, yeah, I guess I should probably do something. And this girl that I was chasing was at SPU. So, and she was actually on the gymnastics team. And she, through her career, had 4 ankle injuries, broke her back, and I was a gymnast through high school, and so that's how I kind of got sucked into kind of interest in medicine. And then I realized that marine biology, there really aren't that many jobs, although there are some pretty cool jobs. So that's kind of how I got directed towards medicine initially. So
you had your own injuries. You had this girl that you were had injuries, and it just became intriguing and interesting enough to you to kind of lead you down that path.
Yeah, so I was helping out with doing some filming of the gymnastics team at Seattle Pacific, and saw these girls just have horrific knee injuries, wrist injuries, elbow injuries, back injuries, and so it started from there. And then kind of the surgeons that were taking care of them, I would kind of tag along and say, hey, show me what you're doing. I'd go to the athletic room and hang out with the trainers and talk to them about injuries. And so so that's kind of how it started.
So it was during that time in your undergrad that you were like, I like marine biology, but man, this stuff's kind of fascinating. And there's a lot of jobs out there for surgeons.
Yeah. Yep. Yeah.
That's a big commitment, Brent. Like you knew you had 9 years of schooling.
No. Yeah. As a young kid, I was 21 when I graduated from college. I had no idea of the time commitment. I knew med school was 4 years, but I had no idea what you did after that. If you just got your diploma and hung your on your shingle out and started working. No, I had no idea what the training was involved.
And those were different times. You couldn't go on Google back then and be like, how many, after I do my 4 years, what's next? Right. Like,
yeah. Nobody warned me of the time commitment of what that was about. And so it was just kind of, take one step at a time and just keep going. Then all of a sudden it's like, wow, it's 10 years later. Yeah.
So as you get in and you do your 4 years of medical school, and you do that at the University of Wisconsin in is that right?
I was at actually the Medical College of Wisconsin. So I was in Milwaukee. It used to be Marquette's Medical School, and they changed it back in the name in the 60s for had something to do with the funding. But
got it. Okay, so you're there. You do your 4 years of medical school. You'd watch these gymnasts have these kind of horrific injuries. It was during that time then you decide I want to become an orthopedic surgeon?
Yeah. So basically first 2 years of med school are just book work. So just studying, anatomy, physiology, pathology, all the
my head hurts just listening to you list all that.
Yeah. And then your last 2 years are where you're spending clinical rotations. So you're spending time with surgery, you're doing medicine, you're doing pediatrics, you're doing OB-GYN, those type of rotations for a couple months. And then you try to, your initial decision is, okay, do I want to be a surgeon or do I not want to be a surgeon? I want to do something else. And then kind of in surgery is like, okay, what specialties, have my kind of pique your interest? And orthopedics was kind of already on the forefront for me, at least.
Okay. So here you are in school. Let's go back to the schooling time.
Yeah.
Challenge after challenge after challenge. Just like all those words you just listed off. I mean, there's opportunities. How did you win through the challenges of school? If you were to look back and find a win that came to you through school, what was it?
Well, so medicine is kind of it's perseverance. I mean, it's truly is dedication. I mean, it's not something that you decide and, you're going to 3 months later say, well, I don't want to do this. I mean, it's something that you truly have to dedicate your life to. And so through that, and then just, tons of studying and book work and being disciplined to do that. And then, if you're good at taking tests, that certainly helps, but they cram so much information into your brain, you got to spit it out. And so a lot of that is, just kind of repetitive stuff like that. So
perseverance is what I'm hearing in there, that perseverance was really something that's a win. You got to stick with it. We've talked about that on many episodes. Just, you got to keep sticking with it and not give up, and the results will work out for you.
But was there ever a time that during the med school days that you were like, this is too much. I don't want to do this. Like, was there any thoughts of I'm done?
So I wouldn't say that particularly, at least for me. For a lot of people, it is. Yeah, because you're either your test scores aren't what you want it to be, and your test scores will decide what basically kind of what specialty you can kind of gear yourself towards. Because there's a lot of specialties that are super hard to get into, and there's others that are don't require as much. So yeah, I mean so once you right before you graduate from medical school, you go through this what's called the match process, and the match process is every senior medical student you put in the computer what you want to do and where you want to go, and you go on the interview trail, and you interviewed several different hospitals for the specialty, and then the hospitals rank all of the students, and it's called match day, and it's usually mid-March, early April, and this computer system spits out where you're going. And so there's like 12 or 15,000 medical students that find out where they're going to do their residency. Well, I was one of the unfortunate ones. First time I didn't match. So here I am. I want to do orthopedic surgery. It's a super hard specialty to get into. It's not uncommon that you don't match. So then you kind of have to scramble. Okay, what am I going to do for a year? Because there's a few spots that are open, but most of the time they're not places that you would want to go. So at that point it's like, okay, now this is really what I want to do. Do I want to go through the whole process again? And so I scrambled for a surgery spot, an internship at Swedish here back in Seattle because it was home. So we figured we'd come home for a year. Came back to Seattle, went through the whole application process again, which is same going on interviews, still trying to work a bunch, and then I was fortunate to match the second time, which was a blessing.
Where did you end up then out of that?
Back where I trained, back for med school, back in Wisconsin.
That's what took you back to Wisconsin. So, Doc, how many times you said that it's not uncommon not to match?
Yeah.
And I remember also when I went to college, because I actually went, I remember
I want to see a diploma or something.
No, I didn't say I graduated, Bob. Listen to the whole story here. Hang on. I remember like at the first day or the orientation, the dean standing up there and saying, look to your left, look to your right. One of them won't be here or they won't be here when you graduate. I always hoped that the person that was on my left or right made it and that my dropping out of college was the thing that helped them be the statistic. How many times does a doctor drop out in the middle of it? As you were saying, perseverance is, and then what happens when they don't match? How many of them just give up and walk away or just become a GP? And I'm not putting down GPs, but they become a general practitioner because they just didn't match and get that extra level that they need. How is that in the world of being a doctor?
So medicine. So most med schools are anywhere from 120 to 210 kids. Usually there's about 10% that end up, dropping out in those first couple years, either because of the schoolwork or they just decide it's not something that they want to do. And then the match process, at that point you basically you're a physician. You're not licensed yet, but you're a physician. So yeah, I mean, most people, if they don't match the first time, if you really, like I wanted to do orthopedics, they'll go through it again. If they don't match the second time, then you got to decide what is there something else that you could use as a fallback career? And most people do. I mean, they end up, and it's still a pretty rewarding, field, yeah.
So there's a lot of winning along the way. There's a lot of losing and lessons that come from the losses along the way and the challenges as well.
Yep, definitely.
Okay. All right. So you're a surgeon, an orthopedic surgeon. You're operating on, as we were talking before, almost all of it, right? The body, I mean, you're operating on all the stuff that basically keeps us moving and other than some of the organs and stuff that we're specifically talking about. So what's winning for a surgeon? Is it just they come out of the surgery okay and thumbs up, I've won? I mean, what's winning for a surgeon?
Well, so orthopedics is kind of one of those things where we can do a lot of things, either minimally invasive surgery now, so arthroscopic surgery. So we're doing tiny little incisions, putting cameras in joints. We're also doing joint. Sorry, my dogs. We're doing joint replacement surgery. And so that's bigger surgery. And so it depends on what we're doing as far as, for a lot of people, the win doesn't happen until they go through their rehab. And so if the surgery goes great, that's huge. And then it goes kind of the healing process and then the rehab process, which can take, sometimes several months. So the reward is it can be kind of immediate, but also there's a long-term part of it too, that trying to guide people through what they need to do to have the best outcome.
Do you stay connected, like as their orthopedic surgeon? Do you stay connected to that process of the rehab for them?
Yeah, we do. Yeah, so we're seeing people, some simple things like a knee scope. If we're clearing out like a little cartilage tear, we'll see them maybe 2 or 3 times in the office. Over the first month or two. Bigger stuff, we'll see them 6, 9, 12 months afterwards.
So you really get the win of now seeing that patient walking normally again, or being able to,
Correct.
use their shoulders properly, or wherever you were working on. You actually get the win. You're not just, I'm going to perform this surgery, and boy, I really hope the physical therapist people get you where you're going.
No, we got them through the whole process. It's super important because it's pretty complex, and a lot of times people just don't understand what they're kind of getting themselves into.
All right, so we're talking about accepting responsibility as the trait here of a winner, because we know that winners accept responsibility. So there were times in college where, well, you had too much fun on a night out with everybody and that test didn't go so well the next day, or, you had that issue. But give us a accepting responsibility experience that's happened with you, where maybe a surgery didn't go just as well as it should have, or something happened during with somebody in the operating room. Give us something we wouldn't have seen.
Yeah. So we try to disclose everything to people before they kind of get into that. So we talk to them up front. We say, hey, look, you have a 95% chance that you're going to do well, that we're going to get you through this and you're going to be fine. But there are some things you need to be aware of. And those things are the typical things with any surgery, so like infection, having a bleeding problem, having some issues with either their rehab or nerves are funny things. And if you can piss a nerve off, then that joint can turn into rock. I mean, so there's a lot of things that we try to, kind of put up front so people know what they're getting themselves into. Probably one of the biggest things is an infection. We have not completely we've cut the chance down really small, so it's like less than 1. But if you get a bad infection, that can just destroy the joint. It can make people really sick, and it can even kill them. And so we all have cases that things. They develop an infection, and then you got to either go back in there to clean it out, which is what happens most of the time. And most of the time we're talking with the bigger surgeries like the hip replacements, knee replacements, shoulder replacements that we do. So those are devastating because people don't understand what can truly happen to their joint until they're kind of in that. We try to explain it to them, but yeah. So those are things that when it happens, I lie awake at night worrying about them and making sure that they're okay. But they're, a lot of times they're in the hospital for days on end and multiple surgeries. And so it can be a real mess.
Does that, and again, you stay connected, like not that you're the one that caused that, right? It was whatever the factor was that less than 1% of the time this thing happens.
Right.
But in some ways, maybe they're sitting there, Brent, thinking, this guy, right?
Right.
Is that a thing? Like, do they? Do they blame you for that, or?
Oh yeah, they do. And there's people that play the system too. I mean, there's people that they expect something out of it. If they had a bad outcome or things didn't go as planned, and they do.
I mean, that's why we have medical insurance, or you have practitioners insurance, or whatever it is, right?
We have malpractice insurance, and for most surgery specialties, it's 20 to. Some people, the biggest high risk ones would be like OB-GYN, delivering babies can be, $100,000 a year.
That just your insurance premiums to cover whatever the, wow.
Yeah.
So in a scenario like that where something goes wrong, you then stay connected to that client to help work them through that, or do they move off to some other doctor that specializes in infections or something?
No, well, so it depends on how bad it is. There are some specialists that we need to get involved if things go really south. But there's specialists at the hospital that are just infectious disease doctors, and so all they do is help take care of patients with infections like that get involved. And so there's a lot of long-term stuff. So. Yeah.
What is it like behind the scenes with blame? And again, take us there. You're saying it's not often that something happens, yet things happen. And it might be that infection. It might be something else that happens. are doctors the kind of people that are usually raising their hand and saying, no, wait, that was all me? Or is it always, no, it had to have been the nurse over there. She brought me this. Or, I mean, talk about that accepting responsibility as a doctor, because we all look at doctors as this, authority figure in our worlds.
Yeah. I mean, we all live in glass houses, fortunately. And so most of us take responsibility and are, it's obviously can be devastating, but most of my partners will man up and say, yeah, this is, we're going to take responsibility and get you through this. Some doctors, in the, they, believe that they're God and it's not their fault, it's somebody else's fault, or they've never had that type of complication. And those guys are, less than, forthcoming and truthful and are hard to deal with because, we all know it's not true.
So it's not just on Grey's Anatomy. Those guys are real.
They are real.
Okay. Just checking.
Yeah. I mean, I can imagine, right? Like you have a lot of power in terms of like people delivering them on the other side of a surgery alive. I mean, that,
right.
I would think over time, if you didn't have the right mindset or you had some character flaws, like that could really manifest itself.
Right. Yeah.
Do you spot those people early, Brent, when they become your colleague at some point, or you're like, oh, here's one of these folks?
Yeah. Oh yeah. We can spot them pretty easily, and yeah, and it's unfortunate when they're when bad things happen because then they usually don't take responsibility, then somebody else has to help them.
So talking about this and this, I don't know a better term for it, and it's probably the right one, I guess, would be the God complex that comes from this. How do you, because you seem to be a pretty down-to-earth guy in the conversation we had before we even started recording and all that stuff, how do you not become a person like that? Because not everybody listening is a surgeon, but that doesn't mean they don't start to develop a God complex in their own area that they're an expert in. How do you avoid that and take responsibility to not become that kind of person?
Well, so I've been married for 33 years. My wife is very good at.
We both identify with that.
Yeah, absolutely.
Pointing those flaws out to me, and she doesn't have. She calls me on it. What she, so so at home I don't get to play that role. But yeah, it can be hard because I come home exhausted and trying to help people through their day, and then but yeah, so mostly my wife.
Got it. Hey,
do you feel like your colleagues play a role in that? Like,
oh yeah, definitely. I mean, we when things go well, we don't really we talk about a few things, but not a bunch. But when things go bad, yeah, we have. Yeah, I have colleagues that we talk about stuff all the time. I mean, yeah. I mean, and another devastating complication that can happen is what's called a pulmonary embolism, or a massive heart attack. And a lot of these people that we're doing joint replacements on, they're older, and we try to find out if they're in good enough shape to go through the procedure. But yeah, sometimes, and we've had people drop dead a couple of days after surgery, and it's either their heart or they had an embolism, and and those are devastating events, and something that that's hard to prepare for, especially just in your training, because you're kind of taught that things like those that doesn't happen, but they do. So
I wish I would have asked for permission to ask this. So if you don't want to answer this question, we'll have Dave edit this out of here. Do you do any kind of therapy or anything around? Like I have a therapist, like, and I don't have people's lives in my hands, but I got a lot of stuff rattling around in this head that I need to get out. Like, is that common, I guess, in the medical field that you guys would be kind of unloading that on somebody? Because that's a lot of responsibility.
Yeah. So initially, no. So in training, it was kind of like you just sucked it up, you take your time to, go cry in the corner, and then you gotta take care of the next one. And so, but now we have support groups. We have people that are trained to help take care of doctors that are going through a hard time. And yeah, I mean, there's, some of those things, you got to live with and process through. And, I'll be the first to admit, multiple sleepless nights, taking care of somebody, then something goes wrong. It's, it gets devastating for everybody involved.
So how do you not get too attached? I mean, I don't want to say we all talk badly about the doc with no bedside manner. We want that doctor that's going to take us through the process and make us feel comfortable. But at the same time, you can't get overly emotional and attached to every patient that you work with. How do you prevent yourself from finding yourself in that situation?
I don't know the right answer to that. I take care of a lot of my colleagues, their families, and you just try to do the best you can. I mean, that's just, so there are people that I've, operate on that are close friends, and we do a lot of stuff together, and I have some partners that they won't do that. They won't operate on anybody. They won't operate on my family or anybody that's a friend of theirs, because they don't want that responsibility. So
I'm assuming you come into every surgery with on point, 100% dialed in. Is there a little bit extra when you're operating on like your buddy that you're going to be golfing with next month?
Oh yeah. Oh yeah. Yeah. You want to be you want to be on point. You want to make sure that everything goes well, and make sure that, and everybody usually knows. So they're all kind of on edge and on the top of their game too. But yeah.
Do you have real quick? Do you have a story about like somebody that you did a surgery for, and you're able to kind of see that their win or your win ultimately, that kind of come back and be like, wow, like this is why I do this?
Oh yeah, no, I get letters from patients all the time that thanks for taking care of me. I have a lot of people that, nowadays, obesity is a huge problem, and it's a major issue, especially if we're doing joint replacements that people don't do as well. They don't get the weight off afterwards. They think that you got to replace my knee and then I'll be able to lose the weight. Well, they don't, unless they change their lifestyle. And so, we'll tell people like, yeah, you got to lose 100 pounds before you can have your joint replaced. And that's all, to tell somebody that, it's super hard, because number one, they can't exercise. So they truly have to change their diet or go through, bariatric surgery to get the weight off. And those people are usually, and I always tell them, look, I'm happy to replace your joint once you get your weight down. But those people are usually pretty thankful once they go through that whole process, and usually get, letters and cards from people all the time of, how appreciative they were, and how well they're doing. So
that must feel pretty good.
Yeah, those are wins when out of the blue you get a note or a card from somebody, and that brightens your day.
Or when you get to work on a professional athlete and then watch them go out and perform at a high level. I know Bob was hoping for you to give him the story about, that time you fixed LeBron's knee or something like that. And then he went out there and, scored 80 points the next day.
Yeah, so I kind of limit myself to high school and college kids. So yeah, nobody's super famous, but yeah, it's a big responsibility, and it's like, well, you think like, well, it'd be great to be the Seahawks doctor or something, but that's number one, you usually have to write a big check to do that. They're not paying you. And then it's a huge responsibility, and a lot of times you're not even doing the surgery. They're going to go see somebody, that's world renowned that does specifically that is world renowned knee surgeon or world renowned shoulder surgeon or stuff like that. So yeah.
Okay, so I wanted to ask you. You were talking about getting into there. Bob was saying, are you at the top of your game? Are you ready when you walk in? And we all think we know everything there is to know about the medical field, because one, well, there's WebMD, and then two, we all watch Grey's Anatomy, right? So we think we know everything about all this stuff. Do you have a routine? Like, is there a winning routine that you say, look, this is how I go into the room, or I listen to this song before I go in, or, this scalpel's always there and I do it with this nurse, or, so that the routine is always set to make as few differences as possible in every situation?
Yeah. I mean, so I would mostly do shoulder and knee surgery. So it's pretty straightforward now. They know, all the people that I work with that have this set up know what we, how we do it, what we, so everything's very systematic, and we have the dreaded checklist to make sure that we don't do anything wrong. And so a patient, they come into our surgery center, they're marking the site we're operating on. I'm marking the site they're operating on. Anesthesia, if they're doing a nerve block to numb that joint up, they're marking the site. And so there's all these hoops we jump through now to make sure that everything's routine and that we don't do the wrong, the wrong site, number one, or something, have something, bad happen like that.
We've all heard those stories pop up in the news every once in a while, right? Somebody went in to get their right shoulder fixed and they got their left shoulder fixed, or
or they got the wrong leg amputated or something like that. I had that interesting thing happen.
Those unfortunately happen all the time, and it's a lot less now because we have created these checklists. But yeah,
can I focus in on that for a second? Because it's not like obviously there's medical boards and in your hospitals and these things, but like that checklist you have, did somebody give you that, or is that something you guys developed over doing surgery so often?
No, we stole it from the pilot industry, pilot checklist. What their process of going through to getting in the plane, starting the plane, and flying it, and taking off and landing. And so they have a checklist, and so we kind of stole that from them. And for the most part, it's worked pretty good.
So you're here in Washington State.
Yeah.
If you got on an airplane and flew to, I don't know, Georgia, I live down there, so I'll just pick Georgia, and you walked into a hospital to do a surgery down there, would they have basically the same checklist? Like, I mean, has it become and I think that's what Bob's asking too, has it become like just a national thing, or is it your hospital, here's our checklist, and it's very different from anyone else?
Most hospitals have adopted that by now because it's a simple thing to avoid, and it's one of those things that it's a multi-thousand or more dollar check you have to write to somebody if you do the wrong site. So it's pretty standard now.
Okay. So, I mean, it's like Southwest pilots and Delta pilots. They might have different planes and different companies, but they're probably following the same checklist of making sure we're all safe to fly. All right. I want to go in a completely different direction because I got to say, just scheduling the opportunity to talk with you has been a challenge for you and I to put this together because you are a busy man, which you should be in your industry, of course. And a lot of our listeners are business owners, or they're in sales. They're busy as well. They're adjusting to whatever the market is. So they're on the go, or they're running their companies at high levels. How do you have a personal life? Give us some tips on how you win on you mentioned a wife, so you've got a marriage that's hopefully successful and going in the right direction.
Lasted for 33 years, is that what you
said? Yeah, 33 years. Yeah.
That's impressive in its own right.
Yeah, right? How do you have a personal life in such a demanding job and industry that our listeners could say, hey, I want to win by having my career and having a 33-year marriage plus wonderful opportunity?
Well, so part of it is I got super lucky with the gal I've married. So that was picking the right gal was 3/4 of it. And it hasn't been easy. It has been hard. There's times where, things have not gone well. And I'll be the first to admit that I was, the first 10, 15 years was certainly not the nicest guy because you're trying, we're all insecure about what we do. And yet we're, here I'm a surgeon taking care of people. And so there's a lot of stress with that. But I would, say my wife, my faith certainly has helped. Key people that I've picked in my life to, be my sounding board also. Several guys that I can name off of that certainly have, helped. And so, yeah. So those are these people outside of your industry? So you're kind of talking to like a fresh ear, or are these colleagues that can commiserate with the things that you're going through, or maybe both? Yeah. So both. So I have several friends outside of medicine that help. And I kind of the motto of, work hard, play hard. And so there's things that I like to do and get outdoors. And
what are some of those things here in beautiful Western Washington? We could probably be doing some of them today, Brent. It's nice out there today. For once.
Gorgeous today. It's the one day of the year. Don't tell everybody it's nice all year. They'll move here.
Yeah, no, it's spectacular. So, wintertime skiing, love to snow ski. Spent 10 years or so working with Stevens Pass with their ski patrol. So there was a ski dock. There's a group of us that would volunteer up there, and so we would work up there and carry radios. And so
you'd be sitting at the bottom of the hill when they bought somebody down in the sled who just blew their knee out skiing.
Yeah, we'd have radios, so we'd carry radios. We'd go skiing, and then they'd call us in if they needed help.
That's cool. So you got to go out there and ski while you were waiting for somebody to blow their knee out. Okay.
Yep. Yeah. So that was a lot of fun. when Vail bought Stevens, that kind of went away. They didn't want to be in the medical business anymore. So that's been kiboshed. But, and then, I love to fish. I love to hunt. I have a couple bird dogs. Love to go shooting. So, yeah. So those are the type of things. And then spending time with my family. My kids all love to ski. My oldest son is in Chicago. He went through med school. He's doing a radiology residency right now, and haven't seen him in for over a year now. So we're gonna go see him in a couple of weeks. But and then my middle son, he's been home since the pandemic. He was actually in Malaysia on a Fulbright scholarship teaching English, and they kicked him out. And he came home, and he's just working now and planning to get married in June. And then my daughter's senior down in college in California. So spending time with them also is important. So, yeah.
All right. So make sure you pick the right partner. That was lesson number one in there.
I was certainly.
You got it, Chad. He just told us we're 3/4 of the way to having a balanced, awesome life.
Awesome. Excellent.
So, yeah, so important. So important. I mean, she's been always kind of the gal that just, can put her boots on and go get things done and take care of, family and kids when I can't, and very independent. But, yeah. So, yeah.
All right. So, Doc, we have been hearing some great wins along the way, whether it's persistence all the way back in school, whether it's, winning through watching what you are able to do and how you're able to accomplish, and it's celebrating those wins when they happen. It's making sure that we're having counterbalance in life so that you're having time with that family and getting through even the rough patches and understanding they're going to happen to everybody.
Yeah.
And that we can push through them and we can move to the levels of being able to build a strong relationship. It's taking responsibility and accepting that responsibility when needed. It's always there for us, keeping that God complex in check, whether that's through friends, family, a wonderful partner. My wife does a great job of every time I come home thinking too much about myself of reminding me of who I am. So again, picking the right partner can be that great thing. Okay, so a lot of wins coming from the world of medicine. I want to ask, this year on season 2 for Win, Make, Give, we're really living up to that give part of Win, Make, Give. And what we want to do is we want to make a donation to a charity that we're doing on every episode. And we want you to pick the charity that we're going to make the donation for from today's episode. So the number of listens we can get over the first 30 days is going to match how much we end up donating. So we're going to hope everybody, as you're listening to this and hearing from Dr. Thiel, some great stuff and some great lessons, that you're sharing this with everybody so we can raise even more money. Yet, Doc, who is it that we're going to be donating to on your behalf today?
So it's the Joey Dietrich Baseball Foundation. Joey Dietrich was a young man that grew up in the Arlington, Everett area. Was drafted by the Tampa Bay Rays, made it through single A, blew out his elbow, came home, started donating time and coaching, and then in 2013 died in a car accident. And I worked with his mother. So anyway, so they started this foundation over the last 7, 8 years, and it's been a great way to give back to the community. So they donate money for scholarships for kids to keep them in baseball. So local, so Arlington, Marysville, Everett, so kind of that area. But anyways,
so they help the kids be able to play, like the young kids be able to get in, and maybe the family can't afford for them to play on the all-star team or whatever. They help those kids be able to play baseball. Oh, that's awesome. Yeah.
So they have a golf tournament on Camino Island in the spring. Usually in wintertime, they have a Bustin' Birds for baseball. So a trap shooting, skeet shooting setup, which is a huge, it's a blast. It's a lot of fun to do, big competitions. So anyways, so it's a great foundation, close to my heart.
Excellent. So folks, even if you can't get out here and get involved in maybe the clay shooting opportunity, just sharing this episode with somebody will help us make a donation to help this organization. And we hope that you're making sure you're part of our Facebook group, facebook.com/group/winmakegive, because once a month, we're going to be asking you for the charities that we should be choosing from to give to for that next month. So we're helping you help the charities in your area that you want to support. Doc, we really appreciate you taking the time and finding the time in your busy schedule today. I'll message you after about this pain in my shoulder I was talking about. We'll see what we can do about that.
Sounds good.
Folks, make sure you're sharing the episode. Make sure you've joined us in Facebook. And remember, as always, do good.